Welcome. I want to thank all of our media partners for joining us again today. We want to remind you, if you're not speaking, to please mute your mics. Today we have with us Dr. Simon and Dr. Michelle Nace, and we have Jeff Cook, President of the Foundation and Foundation Health Partners Online. Jeff? Jeff is still connecting. Jeff, are you there?
There we go. I'm here.
Thank you, Jeff.
Sorry, I'm technically challenged today. Well, thank everyone again for joining us. And, I want to remind those of you who are not media but represent larger employers and larger groups, please get the word out on these press briefings as much as you can. And I know you'll hear more about the Joint Incident Command and plans to broaden our outreach so the general public has more access to our various messages. I can't emphasize enough shelter in place. Everything, every new study or every new comparison comes out showing that shelter in place is the best way to go. And the better we are at that, the sooner we'll be able to lift that shelter in place order. Want to continually thank the citizens of Fairbanks who step up and donate in every way, people making masks. You saw the articles in the paper about Auto Trim Design making shields, and the owner of IT works with his 3D printer. We have a need for bleach at the hospital, and Golden Heart Utilities has been able to step up and make that and provide that. So the cooperation from everybody has just been tremendous. With that, Victor, Joseph, are you on the line? Do you have any comments? Okay, Mayor Matherly.
Hi, Jeff. Hello, everybody. I hope you had a nice weekend. As we head into Easter weekend, I'm told about the numbers, and I hope the doctors touch on this a little bit, that apparently we're in for a kind of a surge. More cases were reported over the weekend. I think nationally we're expecting that as well. I would like to echo what Jeff just said. Shelter in place as much as possible. If you do leave your house, then, Dr. Zink has put out some great videos on how to social distance if you're outside in your yard or even on the street. But if you're not on the street and you're not wearing a mask, don't go out. Do your very, very best to watch that so we can end this curve. It's going to be pretty severe. I've also been brought to my attention today that some of the businesses in town are not quite as diligent as they should be with shoppers, with things in their stores, and I hope that some of those businesses actually can take care of that as soon as possible. Thank you again for these daily briefings, and prayers with everybody who's been affected. So far, I had a friend of mine over the weekend, his entire family tested positive. The 2 kids and the husband and the wife. So we're going to see more of those this week, and I hope we can slow the curve. Thank you.
Mayor Ward, are you online, or Jim Williams? Either one have comments?
Yes, thanks, Jeff. This is Bryce. We've just been working with the Unified Command to establish some overall goals and objectives, hoping that the Unified Command will work to share those with the community on what we're doing from a community perspective, not only to address the health issues that are brought about by the COVID event, but then also some of the other factors affecting our community. Back to you. Thanks, Jeff.
Thanks. Mayor Welch, North Pole, are you online? Not hearing him. Go back. Victor Joseph, did you get online in the meantime?
Good afternoon. This is Jacqueline Bergstrom, TCC. Victor is on a different call right now.
Great. Anything else to add, Jacqueline?
Sure. As far as 10 Chiefs Conference, we continue to stress the message about social distancing and the need to take all the precautionary measures. One of the things that we've been working on over the weekend is the airline situation, since we have the responsibility to make sure that a sheer number of the communities in the interior need to receive all their services, medical supplies and whatnot. And so we're working closely with the remaining airlines on making sure that communities get the minimum needs met.
Thank you. And yeah, Alaska Airlines put out a press release today too about their intention to cooperate in every way they can with continued service to communities as well as working with other airlines. So that's good. Hopefully that'll work out. It's a real challenge. Shelley, back to you then.
So it's with a heavy heart that I'm reporting today our first COVID-19 death in the interior. It was a 73-year-old patient admitted on March 25th that passed away on April 3rd. The patient tested positive for COVID-19. The patient had underlying health conditions, and it is with greatest condolences that we reach out to the family and give a heartfelt, we're so sorry, and if you need anything from us, please let us know. But with that, we won't comment further on the patient to protect their individual privacy. And it's with that I asked Dr. Simon to come to the podium and continue the presentation.
Hi, my name is Mark Simon, and I'm an emergency physician at FMH. I'd like to start today with a video that was created by emergency physicians from across the country.
What's up, America? This is Jack Story. I'm an ER doctor in San Diego.
Jessica Mason here, emergency medicine physician.
My name's Anand Swaminathan.
My name is Jessie Davis.
Dr. Alexandra.
And I want to really plead with you guys to stay home.
Please stay home.
You need to stay home.
Don't come to the hospital unless you're really sick.
Help the healthcare system cope with the outbreak.
Because this is not about just one city, or one state, or even one country. This is about all of us.
And I'm taking care of younger and younger patients who are getting this, who are needing mechanical ventilation. And it's scary. It is scary out there. We want you to stay home and stay safe.
Please stay home right now, because even if you are feeling fine, you might have coronavirus and spread it to someone who won't be fine and could get very sick and die.
You can get my team sick, which means that we can't take care of you when you're most going to need it. We can't take care of your loved ones when they're most going to need it.
We're working really hard for you right now, and we want you to stay home for us.
Stay home for us so that we can go to work for you, I think is the motto.
We stay here for you. Stay home for us.
We stay here for you.
You stay home for us. We stay here for you. You stay home for us.
Before I move on with the rest of my comments, I'd like to ask that we take a moment to honor those in New York City and other locations across the country and around the world that are now in the most intense phase of managing COVID-19 in their community. Thank you. Today, I'm thankful to report that there is no crisis within our emergency room at FMH. I'm thankful to report that we are not putting younger and younger patients on the ventilator, as my colleague from Brooklyn, Dr. Swaminathan, described in the video. I'm thankful to report that our local healthcare resources are not yet overrun with critically ill patients. To be clear, that is not because we are better than anyone else. And that is not because we are somehow immune by virtue of being Alaskans. We very much remain at risk for all these tragic consequences. The reason Governor Dunleavy, Alaska's Chief Medical Officer, Dr. Ann Zink, and all your local healthcare leaders have been stressing the message of stay home, stressing the practice of social distancing, stressing hand and face hygiene, and use of a homemade mask is because those are the only things that separate where we are today from becoming where New York City is today. The only thing that will prevent our community from experiencing the same tragedy is action by you. The only thing that will prevent me as an emergency physician from having the same experiences as Dr. Swaminathan is action by you. I want to take a minute to talk about the valuable work, the critical and often underappreciated work that public health agents do. And I want you to consider your role as a public health agent. Public health by its nature is about prevention, and prevention by its nature is subtle. The tricky thing about preventive care is that you might not know who benefits. Who, by virtue of wearing a helmet, didn't die when they crashed their motorcycle or bicycle? Who, by virtue of getting a vaccine, didn't die from an infection? And who, by virtue of changing their diet and exercising, didn't become disabled by a heart attack or stroke? Most times we can't answer these questions, but please don't let that lack of clarity make you think preventive care is any less important. And where COVID-19 is concerned, prevention is even more critical. The antidote for COVID-19 is not treatment, it's prevention. And the best preventive tool we have for COVID-19 is to limit its spread. I can't tell you whose life you will save by staying home and sheltering in place. I can't tell you whose life you will save by practicing strict social distancing, a minimum of 6 feet apart. I can't tell you whose life you will save by practicing good hand and face hygiene. And I can't tell you whose life you will save by wearing a homemade mask when out in public. I can only tell you that if you do all of these things, you will save lives. I'm fortunate to be in a profession that provides me with the opportunity to help people every day. And at times, I'm able to be part of a team effort that saves lives. You all now have that same opportunity to be part of a team effort that saves lives. The life you save may be your own, it may be a member of your family, or it may be the life of someone you never have the privilege of meeting. Regardless, I hope you recognize the power you have to save lives. I hope you recognize this opportunity, and I hope you take advantage of it. In this moment, at this time, we need everyone to be the best public health agent they can be. Stay home, shelter in place, practice social distancing, a minimum of 6 feet apart, practice hand and face hygiene, and please, if you have to leave the house, wear a homemade mask. Thank you.
Thank you, Dr. Simon. Dr. Nace?
I'm Dr. Michelle Nace, and I want to briefly address some mental health aspects of COVID-19 that affect many of us during this time as we follow shelter in place. Staying at home, and if we must go out, using hand hygiene, wearing a mask, and keeping at least 6 feet from each other. These are not easy tasks, but they are important ones that save lives. They are also ones that create complications while just trying to live a normal life. Grief. Grief results from the loss of something that's important to us, a person, a relationship, a job, and experiencing. When that loss hits, it can paralyze a person with a mixture of overwhelming emotions. Enter COVID-19. We as a city, a state, a nation, and a world are all experiencing the collective loss of the world as we once knew it. And for many, we didn't know what we had until it was no longer there, on a pause of unknown duration. Gone, as we know it, is the routine: school, work, gatherings, physical connections, too many things to even name. I know from living here for years, when individuals in our city have suffered loss, we as a community join together. We support that individual. We pour ourselves into making it better. But what happens when everyone is experiencing loss at the same time, and the nearest shoulder is no less than 6 feet away? Well, that is the time we need to engage in creative forms of I support you, you support me, we support we. Although not in the same room, we can still be there for each other. We can listen and validate those losses without judgment of others' griefs or of your own. Now is not the time to respond out loud or in your head, I know you must miss her that, but at least you're not dying. Or saying to yourself, I shouldn't be sad about this. Other people have it worse. Not allowing yourself or others to feel the sorrow for perceived loss just adds guilt on top of grief. grief for experiencing a normal human emotion, sadness. Sadness for missed birthday parties, canceled sports seasons, emergency cots located where graduated seniors had planned to stand in caps and gowns, lost jobs, lost relationships, lost freedoms, and more. These are all losses that need to be processed and validated with the help of supportive ears, words, actions, and virtual hugs. Only then can we begin to regain strength to make it through another day. As individuals and as a community, we need to step in and help our collective mental health during this time, while understanding we all manage grief and stressful situations differently. When anxiety is stirred, patience is tested, and tempers may flare away from normal baseline. Now is the time to grant grace. Granting grace means forgiving someone in real time for their words or actions that might have resulted in offending you. Instead of absorbing personal injury, judging their whole being, or retaliating, forgive them on the spot, in your mind, and try to move forward. It's possible they're doing the same thing for you as well. To get through this crisis, it can be helpful to search for some moments of gratitude that might occur along the way. I don't mean finding gratitude in the fact that we are having a global pandemic. COVID-19 exists and it's happening in our time. I mean, through this health crisis, acknowledge some of the bright spots that appear along the path. The new relationships formed with a common goal to help, bearing witness to individuals stepping out of their comfort zone to assist others. Entities that may have been somewhat adversarial in the past are now forming coalitions and sharing resources to help this community make it through. The community outpouring has been remarkable. From masks to Girl Scout cookies, from 3D printing parts to free coffee, from oxygen tank to lunch for employees. Supportive signs, letters, and shout-outs of gratitude had made this time a little less stressful and given our Health Scout team true opportunity to be thankful yet again for the community in which we live. These are the little wins that are a result of COVID-19 we have felt cared for and appreciated. This is not an easy time. Now more than ever, we need one another to help lessen our grief. By granting grace to others and finding gratitude-filled moments, we are granting grace to ourselves as well. It will not be forever, and it will end. We are all in this together, and we're going to make it through. We will be stronger on the other side, and that is why we are asking you to be granters of grace, sheltered in place, clean hands and mask face with 6 feet of space. Thank you. Signed, Dr. Nace.
Okay, and with that, we will open the floor to questions.
Hi, this is Erin McBroody with the Fairbanks Daily News Miner. In recent White House press briefings, President Trump is urging the use of hydroxychloroquine as a treatment for this. I know I've heard from you guys in the past, as well as Dr. Zink, that that is not advised, especially if you're doing so without the advice of a healthcare worker. So I just wanted you guys to kind of reiterate your position on that.
Dr. Nace.
So thank you, Erin. The question regarding you using medications, it's considered experimental. It is not an outpatient drug. It's an inpatient drug. We do have it here, and the decision to use that will be made by the physicians at the time if needed.
Next question.
Hi, this is Ramsey from KTBF. We've been getting a little bit of, we published the death, the COVID-19 related death from FMH over our website. And then we've been getting a little bit of backlash with people saying that a death as a result of COVID-19 is not the same as a death related to COVID-19. Could you speak as to whether or not there's a difference, and if so, what that difference is?
Dr. Simon?
So the decision on whether the death is related to COVID-19 is made by the practitioners caring for the patient.
Next question.
Yeah, hi, this is Oz from Anchorage Daily News. This might be a question for the mayors. Mayor Berkowitz down in Anchorage today said that some of his enforcement officials are getting, I think he used the word bullied or hassled occasionally by people who aren't happy about the mandates. And I'm wondering if your enforcement folks are getting any of the same treatment, and also how many, if any, citations have been handed out at this point for people who are violating the mandates.
This is Mayor Matherly. I think I mentioned the other day that we haven't written any because we don't really have a way to enforce this many people to do what the mandates say. I have heard of no bullying at all. I haven't been bullied myself personally as far as the city or any of our employees. If I hear of a violation, I will go right to the mandates and read them every time. And then I will call that business and check with that business, because there's an item number 20 on that list. If you look at his list of essential services, the governor put it out, and that number 20 does say a business who keeps people 6 feet apart within their doors are complying, or some such thing. I've got to read it again. But we don't have the manpower and the time to go and write a bunch of tickets. That's why we've been directing people to email the email address that's available in Juneau, so they can look at enforcement and look into complaints. But there's been no bullying, and we don't write tickets right now. We want to stay inside like everybody else. Thank you.
Next question.
Hi, this is Robin from KUAC. Last week, Dr. Ramirez talked about the needs of the lab, the state virology lab up on the University of Alaska Fairbanks campus, that they still needed a hire and a few other resources. Is that still current this week, if you know? And is there anything the community can do to help support the lab?
I don't think we have the answer to that. Dr. Ramirez isn't here today, so we'll defer that question, Ron. We'll get back to you.
No problem.
This is Erin McCordy with the Fairbanks Daily News Miner again. So this week, I know we've heard reports nationally is supposed to be a really bad week for the states. Is that expected to be the case for Alaska, or are we anticipating that will be delayed a couple weeks given that we're slightly behind the curve?
Dr. Simon?
I would say that yes, we are behind the curve. We are continue as Clint mentioned at last week's press conference, that we are expecting things to get worse and ready for that, but we are behind the curve of other locations, and so we're continuing to be ready and anticipate.
Next question.
Yeah, this is Ramsey again. Sorry, just a follow up to my previous question. I'd like to know, what is the difference between a death related to the virus and a death as a result of the virus?
Dr. Simon?
Yeah, I think we can maybe follow up with additional information after, but again, each decision is made by the clinicians caring for the patient, and we can follow up with some of the details more specifically after.
Thank you.
Next question. Okay, so with that, I'm going to turn it back over to Jeff for closing comments.
Thank you, Shelley, and thank you, everyone. No additional comments, but check with, do any of the mayors have any final comments today?
I have one, Jeff. I really would like to give a heartfelt thank you to Dr. Simon and Dr. Nace. In fact, I hope they post their 2 remarks. I think both of those remarks ought to be heard several times. I really appreciated that. It gave a lot of hope and a lot of honest input from both of those doctors. So hats off to everybody at FMH, and please post those remarks if you can. Thank you. Everybody stay in place and be safe.
Mayor Ward, anything to add? Mayor Welch, did you come online by any chance? And Town Chiefs, any other comments as we close?
No other comments. No, thank you.
Thank you. Again, thank all of you who participate. Thank you for getting the word out. And yes, all please shelter in place. And thank your healthcare providers and everybody in the healthcare profession, whether they're providing housekeeping, dietary, or direct medical services. They're all working hard. They're working overtime. And if you have a neighbor that snows, you know, you don't have to be asked to go over and maybe clean a driveway, clear out that pathway to the mailbox or whatever. So, Shelley, I know you have some closing comments and some transfer information here, so I'll turn it back to you to wrap us up.
Thank you, Jeff. So today we want to announce that the press briefings are now going to be turned over to the Joint Information Center. That's going to be coordinated by Lenine Livingston. The first briefing is scheduled for Wednesday at the same time. FHP will always endeavor to have our docs available for questions for those press briefings, but just remember, as things heat up, that might not be possible. Lenine, do you have any comments?
Hi, good afternoon. Thank you so much, Shelley, for the opportunity to participate this afternoon. So I just wanted to let the community know that the Interior Alaska Unified Command has been doing a lot of work behind the scenes. There are several operational objectives that the group will be sharing information about in the days to come. And so the look of the press conference is going to change just a little bit, but we will still be following the same basic process to have information shared by the medical professionals as well as community information to share. So we just ask folks to stay tuned and be ready for the press conference on Wednesday, same time at 2 o'clock. Thank you.
Thanks, Lenine. So again, we want to thank all our media partners for participating with us. We hope you'll continue to participate. With that, we'll get through this and we'll be stronger for it. So thank you.